I'm Dr. Charles Moak with Allure Medical, and I'm going to talk to you about sleep apnea and a treatment we offer called the NightLase to reverse or restore sleep apnea to a younger period. Sleep apnea is quite common. It's estimated that about 26% or 1 in 4 people over the age of 30 has obstructive sleep apnea, and many times it's not diagnosed because we're not doing sleep studies. There's a test, it's called a sleep study. It can be done in a lab where you're sleeping in somebody else's bedroom. They have it at clinics, or it can just be done at home, which most people would choose. And it gives us a score called the AHI score, Apnea Hypopnea Index. And this tells us how often you're stopping breathing at night. And normal will be 4 times or less per hour, and that would be considered normal. 5 to 15 times per hour would be considered mild sleep apnea. 15 to 29 we consider moderate, and over 30 and over would be considered severe apnea, obstructive sleep apnea. It also gives you another thing called the oxygen desaturation index that tells how many times, how often your oxygen count is low enough that it has brain damage and heart damage to your organs, and you wouldn't know this. So you might feel that you're sleeping fine, but if you have any risk factors for sleep apnea, such as heart disease, hypertension, a thicker neck, being male, having higher body mass index, or having snoring where people can hear it, you have a higher index, a higher risk of sleep apnea. So what's the, we talked about the incidence of sleep apnea is pretty high. It's about 26%. It's much lower in younger people, higher in men than women. What's the implications of sleep apnea? Well, you might feel like you're getting good sleep, and if you didn't know you had sleep apnea, you might want to know this. Again, it's an inexpensive test you can check for. It's about $300. But if you have sleep apnea and it's untreated, your chance of dying goes up. It's very simple. What we don't know is how much of chronic diseases cause sleep apnea, or how many chronic diseases are caused by sleep apnea. There have been several papers looking at this chicken or the egg concept. Leads to obesity. And we know that obesity leads to sleep apnea. We know that sleep apnea leads to diabetes, type 2 diabetes. We know that type 2 diabetes leads to sleep apnea. Which is really the causative effect? They both are, so that they're co-linked. We also know that people with sleep apnea have more cardiovascular disease, more congestive heart failure. They actually get brain damage in the gray matter of their brain, little lesions that show up in MRI, more obesity, more diabetes, more hypertension, more depression, more daytime sleepiness, more car accidents, and more worse quality of life, more falling asleep during the day, you're not feeling as refreshed. So if you have some of those symptoms or issues, it'd be reasonable to get a sleep study. The American Heart Association has recommended strongly in their position paper that adults with any significant risk for sleep apnea, which would again be being man, having a thicker neck, having hypertension, being overweight, or sleeping, get a sleep study done. And if they have sleep apnea, to be treated. Okay, so this is actually probably an epidemic right now. The incidence of sleep disorders has increased as time's gone on. Many reasons. In one case, we've gotten bigger. We have more stimulation at night, so our sleep's not as good. So we have more sleep apnea than we ever have in the past. But let's talk about the health implications of not knowing you have sleep apnea and not treating it. So if you didn't know you had sleep apnea and you do a sleep study and you don't have it, you don't have sleep apnea, don't worry about it. Maybe test again if you ever develop symptoms. But if you do have sleep apnea, should you treat it? And the answer is that the American Heart Association says absolutely. Medical societies say absolutely. What happens if you don't treat it? Well, we know there's simple quality of life reasons. If you have sleep apnea and you treat it and you're trying to lose weight, you'll have a better ability to lose weight. You're trying to get rid of your diabetes, you'll have a better ability to reduce your diabetes. It does lower your blood pressure treated. You will wake up more refreshed. Your partner will probably be staying in bed with you longer because they're not leaving the room because you're snoring. And you'll have more mental refreshness when you wake up. People that have brain damage from sleep apnea, we see this on an MRI, it's quite common in severe sleep apnea. They have these little lesions in their gray matter. It actually reverses after about a year of treating sleep apnea, so it is reversible. It appears that things like diabetes and heart disease and hypertension are reversible, at least to some degree, with treating sleep apnea. A large study done at University of Wisconsin-Madison followed 20,953 patient years over 18 years, so a massive study. And one thing they looked at was who died relative to mild to moderate, moderate to severe sleep apnea. And what they found over 18 years, if you had severe sleep apnea and you didn't treat it, you were 5.2 times more likely to die of cardiovascular disease in 18 years. 5 times. That's substantial. They found that if you were treated or not, your all-cause mortality was higher than non-sleep apnea patients. So not only do we want to treat it, but we want to reverse it. People with mild to moderate sleep apnea had about a 50% increase in mortality. Mortality meaning death in the next 18 years. Sleep apnea is an epidemic, and it shortens your life, especially if untreated. Okay, so now that we have the ability to treat it, what do? Well, the standard treatment has been for mild to moderate sleep apnea with no comorbidities. In other words, no other diseases, no obesity, no hypertension, no diabetes. That's mild to moderate. You can treat with a dental appliance. These are devices that get fitted by a dentist. They go in your mouth or in your nose, and they open your airway up a little bit. And there's some downsides to that: dry mouth, sometimes TMJ syndrome or sore teeth. It does malposition the teeth a little bit, so you need to see a dentist that specializes in this. And that's an option for mild to moderate with no other indications to treat sleep apnea. People with moderate to severe, or people that have other diseases, other risk factors, they might be at risk for heart disease or obesity, should use a CPAP. And that's the machine that goes on your face and blows air into your lungs when you're not doing it on your own. So this is something that assists breathing at night for people who get apnea, and it does reduce CPAP symptoms, and it does help weight loss, diabetes features, reduces cardiovascular disease, lowers blood pressure. So it's beneficial in all methods. There's limitations to the CPAP. First off, most people hate them. Okay, I had a neck surgery in 2015. I had some issues with my spine, and I had to use a CPAP for 3 weeks because the swelling caused me to have a hard time breathing, so I borrowed a machine. And I remember waking up in the morning, and it worked, I slept, but my face hurt, and my mouth was dry for a few hours. And I can't imagine doing that long term. I know some people have to, but the CPAPs do work, but that's the thing, is we don't see much compliance. Most people that get CPAP machines really won't use them. Compliance is considered as using it more than 70% of the nights and 4 hours a night, so it's really like about half the time you're sleeping. Then there's a procedure called the Inspire device. It's an implant that goes into your chest. A wire goes up into your throat into what's called the hypoglossal nerve, and it stimulates the nerve. It works moderately well, so that's something that somebody that can't tolerate CPAP can do the surgery. It costs about $30,000 or $40,000. It's got about 2% major risk rate, and it reduces it reduces the score about 66%, so 2/3 reduction. That's pretty good. The problem is it's very expensive. It's got a high complication rate, and you really want an implantable device. Now the NightLase, which is what we're talking about, is a laser procedure that we originally developed for using it for snoring back, and we've had it for a while for snoring, and we didn't really do a lot of it because snoring is not a big part of our business. However, the newer protocols have showed us how to reverse apnea. Okay, a study published in 2021 in November followed patients who had mild, moderate, and severe sleep apnea, all 3 classes of sleep apnea. And they had 3 treatments 2 weeks apart. So 3 treatments with a nearly painless, non-invasive outpatient laser procedure. They had a 66% reduction in their AHI score, identical to the $40,000 surgery with less risk. In fact, there were more responders in the laser group at 100% versus in the implantable device group. The procedure is done 3 times would probably be a typical recommendation for somebody with apnea. Somebody who's snoring, they can do it maybe twice. And somebody with severe apnea, they might want to do it more times, because if you're severe and you reduce it by 2/3, you might still have notable apnea. So people mild to moderate, maybe 3 times. Somebody with severe, maybe 4 to 7 times. It's going to be based on how you respond, how much swelling in your airway. When we look inside your mouth, we can kind of guess how quickly it's going to shrink. But it tightens the tissues up. So when you look in the back of your throat, people with sleep apnea, you generally can't see that little thing that's hanging down, the uvula, whereas this does shrink that and it lifts it up. There is a surgery that used to do that. It never worked well, so they don't do that. This is a non-surgical procedure called the NightLase. About $800 per treatment. You should do a sleep study before. Maybe do a sleep study after 3 treatments, see if you need it again if you're not sure. No downtime, no dry mouth afterwards, and it can reverse your apnea and improve quality of life and aid in longevity. Okay, so the considerable concern I have is that we want to live longer, healthier lives, and if we have a condition that's hidden, like apnea, and we don't manage it, you find out after you've had the heart attack, after you've had the stroke, once you're having a major sleeping problem. We can pick this up early with a $300 sleep study test. So thank you very much.